My husband and I were married in July 2012. I turned 43 in September, and in December had my annual visit with my OBGYN. For many years before I had a boyfriend or was married, she and I had discussed my desire to become pregnant. As I watched the birthdays tick by, we would discuss the risks of being in advanced maternal age if I were pregnant. December 2012, she had me track my ovulation for a month. When I sent my ovulation chart to her, and her nurse called me. She had worked for years in fertility and let me know since I had an anovulatory cycle, my doctor would probably be referring me to a fertility doctor. 2 months later, I had my first appointment with fertility. My husband and I started the testing process, and I was put on a couple prescriptions to get my TSH and prolactin levels better. I was not starting any fertility medications at this time. They also ordered a hysterosonogram. During this test, the doctor saw a cyst on my right ovary. She sent me to have a full pelvic ultrasound. I had the ultrasound on a Thursday, and on Friday, at work, I received a call from the fertility office. I was told there was a rather large cyst on my right ovary, and I was being referred to gynecologic oncology. The nurse stated, "Someone from that office will call you to set up an appointment," and then hung up. I was left in total shock, at my desk, at work, on a Friday. I grew up with a mom who was a nurse and had been through her cancer 3 times in 6 years. She had 2 different types of breast cancer and lymphoma. I came to the conclusion that although they were not saying it, by referring me to an oncologist, I had cancer. My appointment was set for Monday, 3 days later. My husband came with me to the appointment. When we got to the exam room, I talked to a nurse. She was very nice, took my hand, and reassured us that no one was talking cancer. She stated that many women were referred to them for different surgeries. Of course, this was the first time I heard mention of surgery. In my head, thinking that my fertility doctor was a surgeon also, so why couldn't he do the surgery? I then met my doctor. He was a calm, quiet man, very reassuring. He pulled up my ultrasound pictures to show my husband and I. There was a rather large cyst that looked mostly fluid-filled in the area of my right ovary. He then did an internal exam. After completing the exam, he explained that I would need surgery to remove the cyst as it felt quite large. Surgery was set for April 1st. Still no talk of cancer, so I had to wonder and ask, why am I at an oncologist when no one is saying I have cancer? The answer was given to me months later by a chemo nurse. Many times women get referred to gynec for removal of large cysts in case they turn out to be cancerous. The surgeon oncologist then knows what margins were taken and if there was a need to go back in for more surgery. This would have been helpful information that Friday in March when I was sitting at my desk at work. I had what would be the first of 2 surgeries. It started out as a laparoscopy and turned out with them cutting open my lower abdomen. The cyst, it turned out, was very large. It was a dumbbell shape coming off my left ovary, going behind my uterus and starting to wrap around the front of my pelvis. That was the part that was seen on the ultrasound. They took out the left ovary and the full cyst. On April 9th, 2013, my husband and I sat waiting at the gynecologist's office. My post-op appointment had been pushed up 2 days, and it was a day my doctor was not in the main clinic. I knew something not so good was coming. He sat down across from us in the exam room and stated, "I'm so sorry. I was hoping I would not have to be telling you this, seeing as where you came from. The results show that you have ovarian cancer." He paused for a moment and looked so sad, almost in tears. "We need to do a second surgery to make sure there is no more cancer anywhere." He did give us the option not to have the second surgery, but I would still be getting chemo, and there was no way to tell if I had any viable eggs at this time, and because of my age, I would be beyond the safety age once chemo was done. And we waited the 3 years to become pregnant once I finished. We scheduled the surgery for 2.5 weeks later. I had a copy of the pathology report and was able to find out I had stage 1C clear cell ovarian cancer. The cyst they had removed had been benign endometriosis. This surprised me. I had no signs or symptoms of endometriosis or ovarian cancer. Even looking back over the years and now knowing what the symptoms of ovarian cancer are, bloating, urinary issues, changes in eating patterns, abdominal pain or pressure, I did not have any of them. All I knew at this time was that Gilda Radner had died of ovarian cancer. It was mainly an old lady cancer and pretty much a death sentence. I know better now. No matter what your age, if you have or had ovaries, you can get ovarian cancer. My second surgery removed my uterus, right ovary, and omentum. I was very blessed that no more cancer was found. Unfortunately, 3 days after surgery, the hot flashes started and I was in full-blown menopause. Because my mom and a paternal aunt had postmenopausal estrogen-receptive breast cancer, I'm not able to take any kind of hormones, medical or natural. I was scheduled to start chemo. The original plan was twice every 3 weeks. Day 1 was to be IP, cisplatin, and IV Taxotere. Day 8 was supposed to be IP Taxol. On my first day of chemo, after being stuck 6 times in my IP port, we were unable to start because the IP port was not working. We rescheduled for day 1 for what was supposed to be my day 8, and were told that we hope it would work then. When we left the cancer center, me in pain and bruising, and my husband frustrated and angry. The next week, the IP port was still not working, so my chemo was changed. I received IV carboplatin and IV Taxol. It would be once every 3 weeks. I was very blessed not to have many side effects while going through chemo. I did lose my hair. However, I picked the date it came off and had a haircut and shaving party with my stepdaughters, nieces, sister-in-law, and husband. It was the only thing I could control at that time. They did let me take Amend, a very strong anti-nausea drug, even though I was not getting the IP chemo. And I know this helped with the nausea issues. I also had enough foresight to ask for a dietitian consult, as I needed to have as little fatigue as possible because I had to work through treatment. Know, however, there are a lot of side effects of chemo that no one tells you about. These are the side effects that show up after chemo. Things like weight gain that keeps going, some due to menopause, neuropathy that does not go away, hot flashes from forced menopause, chemo brain, muscle pain and weakness, coordination and balance issues, worsening in eyesight, sexual issues, and for me, an increase in the severity of my asthma. There's also depression and frustration, and for me, there's the continued grieving process for all the children I would never have, that I dreamed of since I was little, and coming to the realization that I would never be able to be pregnant. It was surprisingly difficult for me to get my first haircut. I wanted to hang on to my chemo curls for as long as possible. Currently, I see my oncologist and get my CA-125 level checked every 6 months. I have a CT scan once a year. Because I never had a CA-125 or CT before the surgery, we do not know what is a good marker for me. Currently, my CA-125 level stays around 8 to 10. I also saw a physical therapist and a rehabilitation doctor. I'm currently working with a pulmonologist for my asthma and an endocrinologist and dietitian through the metabolic clinic to try and control my weight. My mom and I have both had genetic testing and are BRCA1 and 2 negative. The other major issue I deal with is survivor guilt. This is very real and affects many of us who are survivors. It comes at very different times and is usually accompanied by the question, why? Why was I diagnosed as stage 1? Why have I not had a recurrence? Why did I not get so sick? Why? The main answer I can come up with is to educate others about this disease and help spread awareness so others do not have to go through it. This is what I can do to make a difference for all my other Teal sisters who are currently fighting for their lives, receiving a diagnosis now, or have been taken from us too soon.